And Dr. Erin Pennison from Terrebonne General Medical Center joins me in studio. Thanks for driving in this morning, Dr. Pennison. Appreciate it.
Thanks for having me.
Every age is important, but the 40s does seem to be a pivotal time for women. Why is that so?
Really, in your 40s, you're trying to prevent health problems that can occur later on. So if you can find out if there's any potential problems starting early, then sometimes lifestyle modifications or changes in diet and sometimes medications can help prevent serious complications later on.
And you say that women should accept the fact that their body will change during this time period. Why is that important?
Well, usually the number one complaint I get from a lot of my women when they come in for their yearly exam is, why am I gaining weight and what do these changes mean and should I be concerned about them? It's usually changes in hormones that cause a lot of the changes to happen. And as long as they're informed and they know that this has happened, will happen, then usually if we can instruct them on lifestyle modification and when to call if a problem really occurs, and then they'll know when to take it seriously and come back.
How important is it for women to maintain cholesterol and calcium levels, and how do they go about doing that?
Well, heart disease is the number one killer of women, and if you know your cholesterol levels and you know your family history of heart disease, then you can make informed choices about dietary changes or medications to keep that in check. Calcium is important to keep their bones strong, because women, once they do go through menopause, will rapidly lose bone loss. And if you can keep your calcium levels high and maintain your bone strength in your 40s, then you're much less at risk for osteoporosis in your 50s.
Are supplements the best way to do that, or can they do that through normal diet?
Most people will have to take a supplement. And usually the recommendation is about 1,200 to 1,500 milligrams a day. Most of the supplements have about half that, so it's encouraged to do probably one supplement and then increase dietary intake of calcium.
Seems like my wife is constantly at the doctor. She's generally healthy, though, luckily enough. But how often should women go to the doctors for these routine blood tests and mammograms?
We usually say in their 40s they should get at least a yearly examination, and that includes a blood pressure evaluation, a weight check, self-breast exam, pap smear, and then we do schedule for mammograms yearly in their 40s. We check cholesterol and other thyroid levels and other things as well.
How important is a regular workout routine to women in this age group?
Very important. The other complaint we get is weight gain, and so building muscle will strengthen not only your heart, but it will also keep your metabolism up so that you're less at risk for obesity.
And is it too much for women to go 2 or 3 times a year? I mean, you hear the horror stories about breast cancer. I mean, is it, can you go twice a year? Should you go twice a year to be checked, or is once a year adequate?
Usually once a year in your 40s is adequate. It depends on the result of the mammogram, your family history, if there's any change that occurs throughout the year. We do take those seriously, and we do follow up with those serious.
Is it, do you get concerned when some people exercise too much in this age group because they're trying to counteract the changes that are going on in their bodies?
You do, especially cardiovascular activity. It actually may burn too much muscle, and they may be more at risk for low body weight, which makes them at risk for osteoporosis as well.
How about iron supplements? Should women in this age group try and take extra iron?
Definitely. And most supplements that you can find, any woman's multivitamin will have extra iron, and we encourage them to get extra iron in their diet through like lean meats and proteins too.
All right, very good. Thank you so much for joining us, Dr. Erin Pennison. Appreciate you being here.
Thank you.